In other words, you know what this says right here, is easier to image larger objects than teeny tiny minute objects. And that makes sense, doesn't it? Doesn't it?
Mm-hmm.
So it is an inverse relationship. Okay, start here. So remember what the fill factor was, is that part of the pixel that receives the image. And let's see what we did on that one. Okay, so most of us got that one right. It increases. The larger this area is, the better the image will be. The more the pixel that we can fill up with the image, the better the resolution. Okay, start now. Please get this one. And make sure, everybody, that your little blue light is on. Is it still on? So you can record. Right, we're gonna get this one right. I'm killing you. Oh, wait, go back. Almost. Okay, we just talked about that on the MTF. Spatial frequency is just another term for resolution. Okay. A lot of questions on resolution and what affects it. Oh, there we go. Yeah. That makes me happy. Oh, I heard that. This was easy. You can do it. We use all of those, but which one is specifically for the TFT and the CCD? Oh, okay, so we got quite a bit, so let's work through these real quick. Selenium is used for the direct method. Selenium is not a phosphor. It's a photo simulator. Anyway, when X-rays hit selenium, it releases electrons. Okay, so it's not releasing light. Selenium is not a phosphor. Cesium iodide is, and that's what we use in our indirect method for digital radiography. So we use, in our detectors, we have X-rays hit the cesium iodide in the detector, it turns to light, and then converted to electrons to make our image. Barium fluorohalide, that is in our PSP plates. Those are in our imaging plates. So go back and look through of what all the different phosphors do for each area. CR and then DR. Okay. We talked about this just a little bit ago. You had the opposite question here. Good. Most of you got that right. So as I said, what increases noise? Anything that produces scatter. So does low kV produce more scatter? No. High kV produces more scatter. Okay. Close collimation, smaller field area, less scatter. Okay. And then we know high mass is the signal, which is what we want. Takes you a second to read all that. So indirect to direct. Okay, and just to review, the indirect method is where X-rays hit the cesium iodide, it converts it to light, and then the light is converted to electrons. The direct method is where X-rays interact with the selenium and just releases electrons to make up the image. So we skip that light part in the direct method. So do we like light?
Mm-hmm.
We do for one reason, for reduced exposure. We don't like it because as anything that emits light, it spreads. So what does that do for our resolution?
Decreases.
It decreases. So let's see what you put.
Yay.
Okay, so most of you did that. A lot of, okay, let's review. What does DQE mean? You've got to remember this. Detective quantum efficiency is kind of a weird name, but it just means that is more sensitive to X-rays. That material or that screen or that image receptor is more sensitive to X-ray. Okay, so the indirect method does have an increased sensitivity because of the cesium iodide phosphor. One X-ray photon produces many light photons. That's what DQE means. If one X-ray photon produced just a couple of light photons, that means it has a low DQE. If one X-ray photon produces a gazillion light photons, it has a high DQE. So it's the conversion from X-rays to light. And we like high DQE. Does that help? Okay, look at this one. So this is exposure index, which is different than the S number. Remember that? Which we hate. Oh no, this one we like. The S number. So, an EI, what is that relationship? So think about that. Okay, so most of you got that one. So EI is a direct, so which we like. The higher the number, the more exposure. The S is the one that is different. So your acquisition pixel size is what you're going to get from your computer that you took the image with, like we do in our GE room. The display pixel size is, the acquisition is like the detector in the table, okay? And then the display is the monitor to the room. Okay, so anytime you see monitor is the display pixel size. And you see monitor pixel size, but that's not what we call it. We call it display because it's displaying the image. So most of you got that one. Okay, start. Okay, so what does bit depth mean? It's the ability of one pixel to do what? To show many shades of gray. So some pixels are only allowed to show a few shades of gray, some pixels can show many shades of gray, and that's called the bit depth. So if the bit depth increases, meaning that pixel can see many shades of gray what happens to the contrast resolution? Everybody remember contrast and contrast resolution are the opposite. What does contrast resolution mean? Okay, so, okay, so what does let's go back and look at our terminology. What does contrast resolution mean? The ability to see many shades of gray. So that's a direct relationship. The bit that is able to give you many shades of gray, contrast resolution would be increased. Does it make sense now? Here's another one going through the same thing. Dynamic range, what does that mean? We have lots of terms to kind of describe the same thing. It just depends in what manner we're speaking of it. What does dynamic range mean? It's the ability of the system, the overall system, to produce many shades of gray. So now here's the word contrast, not contrast resolution. So if you can see black and white and many shades of gray in between, how does that describe the contrast?
Low contrast.
Low contrast. Who did E? Said no E's. So on your, this is more of an imaging plate standard as opposed to digital, okay? So we're talking about maybe a PSP. You can always use a 14 by 17 if you want to do a finger x-ray, but what's going to be the problem? What did you pick? Okay, so you've got a little bit of a variety between 30 and 80%. There's no 80% rule. The only thing about 80% or 500%, if you kind of remember those numbers, is how much underexposed you can be and still have a diagnostic image versus how much over percent you can be and still have a diagnostic image. So you can be over 500% in exposure and still have a great radiograph.
Mm-hmm.
You can be 80% underexposed of your technique and still have a good radiograph. So guess which way we tend to err if we're not sure?
Hotter.
We go over. So that's where the 80 and 500 come in. But in this case, in order to achieve an appropriate exposure index rating, the books tell us expose at least 30% of your imaging plate reader. So that's why you would still, if you're using the imaging plates, you'd want to try to go to a smaller size if you're doing a finger versus something larger. You can still get the x-rays, that's not the issue, it's just that your exposure index number may not be precise, more precise. Okay, window width. We have window depth and window width. So again, look at the term contrast versus contrast resolution. So this is a function that we can do on our computers where you can change the density and the contrast, right? You can change that, right? If you wanted to manipulate it. Okay, so window width determines contrast.
I'm sorry, what is the window width?
Pardon me?
What's the window width?
Is the ability to change the contrast. So we just don't know, do you want a wider or higher or lower contrast? You can change that on the computer. You pull up an image, can't you change it to make it look more black and white, or you can change it to look more gray looking? And what you're manipulating is the window width. Yeah, do that. So, we just did this one. make sure you know your terminology, DICOM versus PACS. Oh, did I just have that one?
Yeah.
Okay, then hopefully you get it. See how your learning curve is, okay, almost. Allow more line pairs per millimeter, what does that measure? Resolution, so smaller matrix, more pixels, bit depth, high frequency signal. When we talk line pairs per millimeter, it's usually a function of the image receptor, not of the imaging, like X-ray tube or anything like that. It's the image receptor.
Yeah.
And it's always going to be a function of the pixels. So, increased bit depth, that's going to give you better contrast resolution. Okay, not necessarily spatial resolution, which is line pairs per millimeter. Couple more. Okay, you should get this one. And the key word here will be pixel, not of the system. Okay, dynamic range is more of the system, whereas bit depth refers to the pixel itself. Okay, the system can have more of a range due to other things, but bit depth is specifically the pixel's ability to display that. So that's the difference between the two. Now this, we did window width before, now we're doing window level.
So what's the window level?
Okay, take a guess. What did window width control?
Contrast.
So take a guess. See how well you guess. So this is a picture out of your textbook, and it's also in your slides. And very good, good guessing, if that's what you did. So window level is brightness, window width is contrast. Okay, last one. Should be 100%. I have to tell you, okay, the key word here, and I bolded it, was the remote locations. So maybe, okay, so I remember the first time we remotely sent an image to a radiologist at home. And we put an X-ray film, the X-ray image on film, on an overhead projector that was hooked up to the phone system. An overhead projector. An overhead projector. Okay, can you imagine what that looked like?
Like crap.
It was horrible. But we were fascinated that that could be sent. Well, the radiologist couldn't They didn't like it. It didn't last long. But I remember that first time. Radiologists have to come out. When they're on call and you have an emergency and they need to read something stat, then they have to come from their home to the hospital at night. Do you know how fun that is for you as a radiographer? And you get some that, they know they're on call, so why do we have the attitude? Why are we all grumpy? Knowing that you're probably gonna get called in, you know, and so, you have to, it's like, I have enough to deal with, and now I have to deal with your attitude, you know, doctor, but anyway, now they don't have to do that. They can pull it up on, you know, through the email or internet or their own, link into our PAC system at the hospital, and they can look at those images, call the ER doctor, tell them, you know, what needs to be done. Or call the specialist to come in, it is a fracture of the forearm and blah, 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 and to call in. So that, the days of them traveling and who, you know, okay, so they're all grumpy, that's hard on you, but guess what? The patient who broke their arm, who needs to go to surgery to have an open reduction, they're having to wait until the team comes in, of course. But part of the wait is the radiologist coming in to read it, sort of thing, as an example. Okay, we'll stop there. Okay, so look over, these are the questions that you had, you know, before last semester. So I did repost that PowerPoint, so just go back through, hopefully it's just a review for you. And so you have an idea of some of the questions you'll see again. Yeah. Yeah, and that's just what your test is.